Hello, my name's Suzanne Dawson. I'm one of the admissions tutors here at Leicester Medical School, and I'm a Leicester graduate, having started here in medical school in the 1980s. I'm going to talk to you a little bit about the course. I'm going to talk to you about entry requirements for 2027, but I'd also really suggest that you read our website, you look at our FAQs, you look at some of our on-demand videos that include those from current students, and if possible, you try and come to one of our open days. We'll be holding these in July, September and October. So as I said, I'm going to talk to you a little bit about Leicester, the course and the application process. So you're obviously thinking about Leicester, and that's brilliant, but I'd also suggest that you look at the Medical Schools Council. This gives you a lot of information about the different types of medical courses. It allows you to put in your current qualification, so you may think about where you might be able to make a most competitive application, but it also tells you lots about the process of applying and gives you interview help, etc. So I would really suggest that you look at that. But I also want you to make sure that you've really thought about whether medicine is the career for you. This is a cutting from an article that was in the BMJ, because there is no getting away from it. Medicine is a difficult course and it's a difficult profession, but at the same time, it is the most brilliant profession. There's never a day that's the same. Every day you're learning, and what you can learn from patients and what you can do for patients is fantastic. What about Leicester? So Leicester's a great city. Obviously, as I said, I came here as a student, I've never left. It's been named as one of Europe's top cities. There are actually two universities in Leicester. There's the University of Leicester and then there's De Montfort University. There's lots of things that go on in Leicester, and I would really suggest that you look at the Visit Leicester web pages and also start to think about following things on social media. It's got great transport links. It's just off the M1. It's got a very good intercity train service. There are two international airports within an hour's drive. Costs of living is not bad. It's actually considered one of the most reasonable cities, and generally speaking, for a city of its size, it's very friendly, it's welcoming, and it's safe. In terms of the medical school, we've had one here for over 50 years, and that means we're used to running the course, we're used to producing high quality candidates and students and doctors, but that doesn't mean we sit on our laurels. It means that we have refined things and continue to refine things to give you the best possible education. So why might you want to come to Leicester Medical School? Well, we have a highly regarded patient-focused curriculum, and the reason we know it's regarded is that we've been asked to support other universities in the UK and abroad in setting up their curriculum. We've won a number of accolades, and you can look at these yourself. We like to think we support traditional learning, but have a lot of innovation as well. And if you do come to one of our open days or offer holder days, you'll be able to see some of our technology enhanced learning. We give out iPads, we use 3D printing, we still have full cadaveric dissection, which a lot of medical schools no longer do, and personally I would say that that is a brilliant way of learning anatomy. It is such a privilege that people still donate their bodies, and I still would use that knowledge in my clinical practice today. We have a dedicated student support service, and I'll talk more about that. We're one of the few universities to have a specific centre for empathic healthcare, empathy being really important in healthcare. And we have good, if not outstanding, facilities, including our George Davis Centre, which houses most of the medical school teaching, which is a new passive house building. And I'll come back to our clinical skills centre later on in the talk. But perhaps most importantly, we have happy students. Every year, students who are graduating are asked to complete the National Student Survey, and this is the results from 2025. The same were pretty much for 2024, and we're awaiting the release of those for 2026. What we're most happy about is that we're first for subjects aligned to medicine for overall positivity. And as I said, this means that our students are happy with the way they're taught, the way they're assessed, the way they are listened to, and they feel prepared for their future career. We have a good research ethic. We have lots of local, national and international research projects going on. And again, if you look at the rankings, we score well. We were very highly recognised during the COVID-19 pandemic, but we have a lot of other areas where we have ongoing research. And I'd like to draw your attention to the Precision Medicine Institute and the Biomedical Research Centre. Precision medicine is going to be the way that you practice medicine as time goes on, because we now have the ability to look at how individuals may respond to treatments and therefore tailor things specifically to them, and that's going to be very much a growth area. So what about our courses? We have 2 courses, a 6-year Medicine with a Foundation year course, which is A199 on UCAS. That has 1 year called the Foundation Year or Year 0, and it then feeds into our 5-year standard entry medicine course, provided students finish the assessments at the end of Year 0. Both courses lead to an MBChB degree, so you have a Bachelor of Medicine and a Bachelor of Surgery degree. All students in the UK have to sit the medical licensing assessment, and at the end of this means your primary medical qualification entitles you to provisional registration with the General Medical Council and to apply for foundation training within the UK. That's the same for any medical school. If it's MBBS, it's exactly the same. They've just adopted surgery rather than the Latin for surgery, CH. What about the style of learning? We would say we provide learning in a clinical context, and right from the start you will be involved with patients. We use a mixture of lectures, guided group work and self-study, and because of this guidance we are not a problem-based learning course, but there is a lot of group work as well. As I've mentioned, we have full cadaveric dissection. We have clinically relevant practical classes so that you will practice in a very safe environment rather than on each other or in the clinical placement on patients as we did. There'll be specific consultation skills. You'll learn from patients, and as I again previously mentioned, we use technology. So this is a picture of our dissection room. We are not allowed to show you pictures of the cadavers. They're hidden away in one of the corners. It's large, it's air conditioned, it no longer smells as bad as it did when I was a student. You will be put in a small group, usually of about 8 to 10 people, and each group will have your own cadaver to work through the dissection. We will supplement this with 3D models, printing, prosections, and online resources. The clinical skills unit, the main one we use is at the Leicester Royal Infirmary, which is about 10 minutes walk from the university, but all of our hospitals will have clinical skills units, and this allows you to practice your practical skills on dummies, which are of very high quality, and to practice simulations of high pressure scenarios, and this makes you much better prepared for when you have to do them in real life. Patients are at the root of what we do, and therefore it's really important that you learn from patients, and we have a very active patient and carer group. If you come to one of our offer holder days or our open days, you will be able to meet them. They will be involved in the healthcare certificate training, clinical simulations, our health enhancement programme, and our compassionate holistic diagnostic detective course, which is what we call the theme that runs clinically through years 1 and 2, where you're learning the bedrock of medical practice, i.e. how to take a history and how to examine and how to make a diagnosis. The health enhancement programme cannot be underestimated. If you do not look after your own health, you cannot look after a patient's health. So the Medicine with the Foundation Year course currently looks like this. There are 4 modules, And it's really an opportunity for you to develop your skills so that when you progress into year one, you are at the same level as those candidates and you transition seamlessly. You're a medical student right from the day you start. The only difference is about the term times and the modules. I must just draw your attention though that because we are constantly refining things and we are trying to make things as best as we possibly can for you, the foundation year content is currently under review and it may not look exactly like this for 2027. We obviously will update the website and update you at offer holder days as and when we know more. Then the 5-year course looks like this. And if you go on the website, this is an interactive diagram. If you click on any of the boxes, it will tell you more about those. SSC stands for Student Selected Component, and this allows you to choose something that you're interested in and to study that for a period of time. The apprenticeship we very much consider to be your first year in clinical practice when you're sort of learning about how things work on the ward, gaining your confidence, getting used to doing some of the practical skills. Whereas in year 5, you've then progressed to become an assistant. And this is very much that you are definitely part of the team and that you're learning what you're going to be doing in the August when you graduate. Which brings me to the clinical environment. So much as we have high academic requirements for entry, medicine is not just an academic degree. There are a lot of practical skills that you need to be able to do. And most importantly, you need to be able to communicate with the patient, their relatives, and other members of the team. All medical jobs, and there are many different career options, involve teamwork. And it isn't good enough just to be good academically. You also need to master these skills. You'll need to examine everybody, regardless of their background, regardless of whether you don't like feet or not. You're going to have to look at feet. That was the area that took me the biggest challenge. And you're going to remember that the NHS has current dress codes. Now they may change, for instance, there may be disposable sleeves that can be used, but you are going to have to be happy to work in those environments. So please make sure you have considered that. So the hospitals we use are mainly the 3 in Leicester: Leicester Royal Infirmary, Leicester General Hospital, Glenfield General Hospital. They're all one trust, they're all connected by a free hospital hopper. We also use the Leicester Partnership Trust, which are mental health and community services, and where I've worked until recently. But as with any medical school, you will also go to other hospitals. The main ones we use are the ones in bold on this slide. They may change though during the duration of your course. If one of these is deemed to be not within commuting distance, we will provide free accommodation. Although I should say the trust will provide free accommodation. We cannot control that accommodation. We can tell you that you will have your own room, that it will be lockable, but we cannot tell you that it will be single sex, as that is outside our control. And you need to bear that in mind, and that will probably be the same for any university. There's the opportunity to intercalate, and we have a number of opportunities here in Leicester, but you can choose to go elsewhere provided it fits within the academic year. Some people will do an intercalated bachelor's degree, some will do an intercalated master's. You cannot undertake a master's until you've passed the 3rd year of our course, and so a lot of people are now intercalating between the 4th and 5th year in Leicester. There are many other developmental opportunities. Everybody gets the opportunity to go on an elective. Some people decide to go abroad, other people stay in the UK, other people stay in Leicester. It really depends what your interest is and what you want to do. We offer the healthcare certificate for everybody, and this will allow you to go and qualify as a healthcare assistant should you wish. As I mentioned before, we have student selected parts of the course. We have a number of outreach projects that are in progress, and we have a really active student union both on the main university but also within the medical school itself. And if you come to one of our open days or the offer holder day, you'll meet people from Leicester. In terms of personalised support, we know medicine's hard. I said that at the beginning, and therefore we offer a lot of support because we want to get the best out of you. We want to support you. So everybody will have a personal tutor, and that will either be an academic member of staff or a clinician. That will be the person you'll seek during the first and second year, and then in the third, fourth and fifth, you'll have a clinical academic tutor. You'll be able to access support on the main campus. That might be welfare, it might be accessibility, but you can also use our own support service, which might be academic or pastoral support. As I mentioned earlier, we will also try and get you to look after your own health by teaching you about wellness and health enhancement. All our block leads are very approachable, and we really, really do believe that if you are struggling, you ask for help. All of our accommodation also has 24-hour support as well. So once you graduate, so you complete our course, our exams, the medical licensing exam, you then get professional registration with the GMC and can apply to the UK Foundation programme. And currently, all of our graduates are getting places and they are progressing well, and our graduates are amongst the highest earners. So our doctors are prepared. So what about applying to Leicester Medical School? Having given you all that information about the course, you may now want to have a pause, grab a cup of tea, have a comfort break and come back to listen to about applying. So what are we looking for? Well, as I've mentioned before, medicine is academic, but it is more than an academic degree. So we need people who can relate to the population, who are empathic, who can adapt, who have the ability to treat everyone with respect. Medicine's high pressurised, so we need you to thrive with responsibility. We need to deal with uncertainty. There are no two patients that will present in exactly the same way. There are no two patients that will respond in exactly the same way to medication, and there are no two patients who will have exactly the same outcome. That uncertainty is not for everybody. You need to be resilient. You will make errors. We all do. Statistically, most of us are likely to end up in the coroner's court at some stage. Not a nice experience, but again, you need to be prepared for that. But as I also said earlier, this is a great, great career. And if you like problem solving, if you like to be curious, if you like to be nosy, it's brilliant. And as a geriatrician, boy, do you need to be nosy and inquisitive. But you do have to have that interest and aptitude for science, and that's why we have the entry requirements that we do. So the entry requirements can be found on the website, and this is what our landing page looks like. Please make sure you read this, the entry requirements, and the scoring document, and they're different for A100 and A199. Just to note that we've made a change for 2027. For the A100 and fee status. In terms of A199 course, we've only ever considered home students, and that's because that was how the course was set up by the philanthropist. In terms of A100, selection for interview will depend on your fee status as it is assessed on the date of application, i.e. the 15th of October 2026. However, if it changes between then and the 1st of September 2027, what you pay will be determined by your fee status on the 1st of September. If you will be currently assessed as an international student and you're worried that your application won't be competitive enough, as historically it is harder to get to interview and offer as an international student, we suggest deferral. We have no problem accepting people with achieved grades. In fact, it makes our life easier. But I'm afraid with the current possible changes coming to fee status, we won't accept deferred application as for this reason, but we will reconsider another application from you in 2027 for 2028 entry. So for A199, these are our minimum requirements. The GCSEs, and the A-level requirements, and I suggest that you pause this slide to look at things in more detail. The most important thing is that you must have chemistry or biology and another subject from chemistry, biology, physics, maths or psychology. And you must be within 2 years of leaving school and have not started any higher education. The widening participation criteria are in much more detail on our website, and do make sure you meet those. We will send out eligibility criteria for those people we're considering inviting to interview. We won't ask you for that information prior to application other than the IMD, which is on your UCAS form anyway. In terms of A100, the subjects are the same, but we ask for higher GCSEs and A-level requirements. We do have some contextual offers for people who've completed Realising Opportunities programmes or Access Leicester Medicine or a Sutton Trust Pathways to Medicine course. We also have a contextual offer for people who meet the widening participation criteria listed here. If you're a graduate, then again you must have our minimum GCSEs. You also need to meet these A-level requirements with at least a B in chemistry or biology. We'll take any degree as long as it's an honours degree at a 2-1 or above. We do accept a number of international qualifications, and we consider access to medicine diplomas in certain situations. Further information of this is on our website. In terms of the GCSEs, you can resit English language and maths, but we won't accept resits in other subjects unless it's been previously approved by the Mitigating Circumstances panel, and information about the Mitigating Circumstances panel can be found on our website. All applicants must have evidence of educational attainment within 3 years of the UCAS closing date. So selection for interview is clearly laid out in our scoring document, and as I said, that's on the website. There's one for A100 and there's one for A199. When the forms come in on the 15th of October, and there's usually about 3,000 forms, the first thing that we do is we look at fee status, and we check that you meet the minimum criteria, so the GCSEs, and also your predicted A-level grades. In most situations, we then score you on your academic and UCAT performance, and that is weighted 50-50. We then rank you within your groups, and we take the highest scorers through to interview. We then will look at a few in a borderline group using contextual data. Some students might be eligible to go straight to interview, and that's if you're through one of the widening participation programmes, or if you're an achieved A-level candidate who meets certain criteria. And again, these are all laid out in the scoring document. Personal statements we do not routinely read before interview, but we will read them before we make an offer. So please make sure you've written it yourself, you keep it concise, and you reflect on whatever you've learned from the life experiences that you've had. Work experience, we do not have a minimum requirement, but we do ask that you have used your experience to think about whether you can work in a public-facing role, and also that you really have considered whether medicine is the career for you. A reference is mandatory. Any applications that come without a reference will be automatically rejected. We will read all of these before offer, but we will also look at the extenuating circumstances pre-interview. If you have a specific learning difficulty, disability or health condition, please, please, please declare it. The reason for this is that we may be able to offer you reasonable adjustments for your interview. But also, everybody starting a healthcare professional course needs to meet certain occupational health requirements. And we need to know whether we need to refer you to an occupational health department to see what support and adjustments we need to do. In my many years of doing this job, there has only been one student who, for health reason, we have not been able to accept on the course. There are many people that are referred, and most of them, the whole purpose is to be supportive. If you want more information about the occupational health requirements, then I would suggest that you look at the HEOPS MBCHEOPS website as listed below. So in terms of UCAT, don't forget that the testing changed in 2025, and so the whole score changed. Therefore, we have 1 year of using our current scoring matrix. If you look on our website, you can see the statistics for 2026 entry, but remember that's just 1 year's data that you've got. We score it out of 48. If you're in the bottom 2 deciles, it is probably not worth you applying to Leicester. If you have an SJT band 4, you will automatically be rejected. UCAT states very clearly that the most important thing is practice, and it suggests 30 to 40 hours. And the best practice seems to be the papers that are on their website. You do not need to pay to go on a course. And please remember that if you're eligible for the bursary, that you apply for it, as we use this as a contextual flag. In terms of academic scoring, for the vast majority of people, this is on GCSEs only, since the vast majority of our applicants are predicted A-levels. We will score English language, maths and 2 sciences, chemistry and biology for everybody, and then your next 4 best grades. We won't double count maths and further maths, we'll use the best one. And we want everything done in the same year. We will only score early GCSEs if they're the mandatory subjects. If you're an achieved A-level candidate, then it may be that we just check you meet our minimum. We might not score you at all and see the scoring document for further information on that. If we do score you, then we use the same 8 subjects, but we might give bonus academic points if your A-levels exceed our minimum. For A199, it's again the same, but the scoring is a little bit different in that we split the we don't split the grade A and 9. If you're a graduate, again, you have to meet the GCSEs requirements. We score you at A-levels, we score your degree, and the UCAT scored exactly as before. Internationals, you may not have formal examinations, in which case we need school transcripts. And as you see on our website, we'll ask you to send these in to MedAdmis. On the acknowledgement email when you apply, we will also ask you to make sure you've sent these in. We won't chase further than that, so please, please, please send your school transcripts in. If we're in any doubt as to whether your qualifications meet our minimum, we use ECTIS for our equivalents, and then we base scoring on UCAS tariff points. Interviews. We will run our interviews in December and January, and the dates are on our website. Please make sure you do not book holidays for the whole of this period. The interviews will be to look for things we can't assess on your UCAS form. And our top tip is that you answer the question you're being asked, not what you think you're being asked. You don't need to go on a course. We do suggest, however, that you practice being asked random questions by different people, and that you get used to answering even in a set time. That seems to be the most difficult thing. So we will tell you, for instance, that you've got 4 questions to answer in 8 minutes. So get used to what 2 minutes feels like. We will also have a numeracy test, as numeracy is really important. Drugs are very, very dangerous things. Offers, we will start making offers probably in February, with the aim of having offer holder days in March and April. But because of the UCAS deadlines, and when everybody gets all their offers and then makes their decisions, having attended offer holder days, etc., we may have to make more offers later in the cycle. We can't help that. We cannot go over our numbers. We get fined significantly by the Office of Students if we do. We're a capped course. And so some people, I'm afraid, will not hear before the deadlines, will be asked to go on our waiting list and may not get an offer at all, or maybe made a late or deferred offer. This, I'm afraid, is the system, and we can't change that. So why come to Leicester? This slide summarises the reasons why I think you should come to Leicester, or rather we do, because it's not just me who's put these slides together. But in summary, we would say we have happy students. that are ready to work in a practical environment as a foundation doctor in the UK. And they have studied in a happy, safe, affordable city. Thank you very much for listening. Bye-bye.